Tara Campbell, WWT. With the Hispanic population continuing to see a disproportionately high number of confirmed cases of COVID-19, will you consider on-site testing in Latino communities such as South Omaha? So first of all, Tara, we have been doing this, not only in South Omaha. For example, One World has been doing roughly about 100 tests a day, and we have been in conversations with them on how to ramp that up even higher and get them some assistance, for example, from the National Guard to give their team a break. So we plan on continuing to do that, as well as in North Omaha. But we've also been in Hispanic communities, just broadly speaking, in helping do testing in places like Lexington or Grand Island or Dakota City or Crete or places like that. So we do recognize that we've got a need here, and so we are looking to ramp that up. If not, how will the state address concerns over the lack of internet access with the Hispanic community and therefore an inability to participate in Test Nebraska? So again, if you do want to fill out the Test Nebraska website in Spanish, you can go to testnebraska.com/ES. The issue with regard to lack of internet access, however, is not unique to the Hispanic community. There are a number of people who don't necessarily have that internet access. And it's, again, while we do the regular testing we're doing, for example, with the Nebraska National Guard that continues to rotate around in different parts of the state. And again, if we're looking at like the solutions we're going to be doing for One World, that will not necessarily be a Test Nebraska solution. That will be something where you don't have to access through Test Nebraska to be able to do that. So we are allowing other channels for people to be able to get that testing done. That's not just testnebraska.com. But if you want to do it in testnebraska.com, that's a good thing. testnebraska.com/ES. Okay, so Charlie Brogan. I've interviewed several seniors who received emails after signing up with Test Nebraska. It directs them to scheduling section of the program, but when they click on Lincoln, it tells them that there are no times available and encourages them to check back another time. Is each testing station going to stay in operation as long as there are tests to conduct in that community? If so, why wouldn't scheduling software give options for future dates, even if it is just a few days or a week into the future? So, yeah, again, so these are mobile testing sites, so we will move them around the state. So while there is one in Lincoln right now, that one, I believe, will be moving at some point. So we schedule these, we have scheduling sites for a few days out, but again, a lot of those slots filled up when we went to people who were 65 or older. So again, we just asked for your patience for folks to continue to check back on the assessments and the opportunity to schedule those. We will continue to test people. So we've got lots of capacity to continue testing. We will do it, but please be patient for us as we work through that. Okay, Rex Kumpf, KJSK. Are you going to be issuing guidance in respect to county fairs and specifically 4-H livestock shows? So yes, we've got a team of folks who are working on coming up with some guidance with regard to county fairs for next month. So that is something that is in process. What is the timetable on auto racing tractor pulls? Some states have allowed events like this with no fans. Is that a possibility, or with a limited fan participation? We actually are allowing some of that right now. For example, in Grand Island at Fauner Park, they're doing horse racing without crowds. So that is going on right now. In fact, I think I read that was like one of 8 tracks in the country that was still operating. And then, at least at that time I read the article. And then we have done some auto racing where it was appropriately socially distanced with regard to the crews and everything. Again, there was no spectators allowed. So if you do have an event like that, I suggest just reach out to the governor's office to make sure that you're going to be complying with all the guidelines with regard to social distancing and that sort of thing. But we have allowed some events like this to go on. But again, limited circumstances, certainly no fans, limiting the amount of social interaction, all, with those social distancing guidelines that we've established. And 402-471-2244 is the governor's office if you want to call in and ask about that. Melanie Wilkinson from the York News Times. Are there any projections about whether or not the Cornhusker State Games were going to happen this year? And if so, how would that look? So, and then she also has another one for the Seward 4th of July celebration as well. So we haven't done anything for July, so I don't have any information to be able to give you with regard to those. I can tell you we'll be doing social distancing for a while. There's some limitations on the size of crowds that'll be gathering for a while. So we haven't come up with guidelines with regard to those 2 events. But again, you can expect that there's going to be, if those types of events are going to be going forward, there'll be limitations with regard to the number of people who can attend. But again, what we want to do is, again, continue to see how, as we've loosened some of these restrictions here in this month, how that continues to go for us with regard to hospital capacity, and then we'll make some decisions with regard to June, and then in June we'll make decisions with regard to July. Ryan Boyd, KGFW. The directed health measures are slowly being altered as COVID-19 is continually tracked. Bars and restaurants are reopening with restrictions on things like capacity and only being seated if ordering food. What does the state think about the timeline for bars that only serve alcohol? That's, again, something that is under consideration. It will not be happening in the month of May, I can tell you that for sure. We will be taking a look at the data as we go through the month of May and making decisions about June based upon what we see happening in May. So I'd say just stay tuned with regard to bars that are not serving food, but they will not be, that will not be a step we will be taking in the month of May. Scott Carlson, North Platte Post. I've had numerous business owners in our community reach out to us and state that the local health department has told them that if they are not compliant with DHMs, they can be charged criminally with misdemeanors. My question is, can private citizens really face criminal charges for operating a free business enterprise? So, Scott, yeah, again, in a time of emergency, when we issue these directed health measures, violating those measures is a Class 5 misdemeanor. So you can get ticketed for violating the DHM and get a Class 5 misdemeanor. However, I think that, first of all, the State Patrol has not ticketed anybody, right, Colonel? You haven't, so the State Patrol has not ticketed anybody for that. And the first step is not just to run out and have law enforcement jump in here. When I've been talking, for example, with mayors or other folks in different parts of the state, what I've asked is, if you see somebody who's not following the rules or you think can be doing a better job, just reach out and call them. Call the manager, the owner. If you're just a regular citizen, you can start by just talking to the manager. If you feel like that's not working, ask your mayor to make the phone call. I got to tell you, so many times when that's happened, the business has been accommodative, has taken more steps. And I always use the example of the mayor of Omaha, Mayor Stothert, has worked with the big box stores in Omaha to get them to take more steps. They have, when she reached out and called them, they were willing to do that. That's really the first course of action, is to just open up those lines of communications, talk to people, ask them first to see if they can do a better job, and that's worked. Nebraskans do the right thing. So certainly, like I said, there are legal ramifications of this, but that's not where we want to start. Brad Bean, KHAS Radio. Who makes the final decision on loosening the DHMs for the health districts? Is the final call made by the local health district, by someone at DHHS, by the governor? Will you walk us through the process when making the reopening decision? So what we do is we tend to work with the local public health departments. So, for example, we made the announcement this week with regard to 4 of the public health districts that loosened some of their DHMs prior to May 31st. We called and walked them through the process, or walked them through their data with regard to hospital capacity, kind of just what was looking like with regard to the percent positives that were testing in their local public health district. Everybody was comfortable with loosening up those restrictions, and so then Dr. Antone, our chief medical officer, and myself, I think actually you're the one that signs the DHMs, but we ultimately try to make this a very collaborative process. At the end of the day, the buck does stop here at the governor's office with the chief medical officer and I, because we're the ones that officially sign off on all these. The local public health departments can't do it on their own. It has to be okayed by the state, so ultimately we do, but we try to make it a collaborative process with those public health districts. Paul Hamill, Omaha World Herald. How many people via Test Nebraska who indicated that they have symptoms have been tested positive? So Paul asked this question yesterday. We checked into it. We actually don't track that data. So I'm sorry, Paul, you're not going to be able to get the answer to that question. We don't track it either in any of the regular testing we'll be doing or in the Test Nebraska, so we don't really track that. How many people who Test Nebraska said needed to be tested have been unable to schedule a test? Again, we don't track this one either. We just ask people to continue to be patient with us and continue to try and get those tested. We had a lot of people trying, when we loosened up the restriction to allow people 65 or older, we had a lot of interest in getting those tests done. And so just continue to check back with the site to be able to get those time slots scheduled. And again, just a reminder, that's the only way that you can get tested is through scheduling it for the testnebraska.com. What is the expectation on when they might get tested? So again, we're working through the process. There's lots of people. I think we've talked about over 135,000 people have signed up. It's probably more now. So Lots of people, again, we're continuing to ramp up the amount of testing. We swabbed over 1,200 people yesterday, but you can see it's going to take some time to be able to work through this, so continue to check back on the site. What is the update on adding people at the call center? Have more been added, and when will that happen? This has kind of happened this last weekend, so we're still working through that process for how we're going to do that with regard to ramping up the capacity at the call center, so I don't have an answer to give you on that. And a reader says that when they access the portable to get the results of their test, they were asked instead to schedule a new test. Is that a glitch that has been common? Is it fixed? Actually, that is the first time we've heard that one, Paul. So you could ask that reader to reach out to our office to get the details on that, because that is one I have not heard yet with regard to going back on to get your test result and then being asked to schedule an appointment. Also a reader question from Paul Hamill. What can the governor do to prevent a price gouging by meat packers for a price of beef? Prices at grocery store have gone up while cattle producers get less, he says. So this is an issue that has not just been with regard to this pandemic. You may all recall that we had that fire in Holcomb, Kansas at a facility there, a meat processing facility there. That actually spurred the U.S. Department of Agriculture to start an investigation with regard to the practices and how the pricing was being set for box beef versus what our cattle producers were getting for it and so forth. And also our Attorney General has requested with, I believe, 10 other states to send a letter in to the Department of Justice, the U.S. Department of Justice, to do an investigation with regard to pricing in this industry. And just a few days ago, President Trump also asked the Department of Justice to look into this. So this is a known issue, and the Department of Justice, I presume, is doing the investigation on the industry with regard to pricing and how that's working between the price that the packing industry is charging other people versus what they're paying for the producers who are bringing the cattle. Taylor, where are you? Taylor, you got any questions for us that were texted in?
Bill Shammer would like to know, many bars feel that they're being treated unfairly. Do we think they'll need to be open by June 1st, and what factors into them staying closed?
So Bill Shammer says, hey, bars feel like they're being treated unfairly, and do we think they'll be open by June 1st, and what factors will play into that? Again, just what we said before is that we're going to be reviewing the data here in May, and we'll be giving guidelines for June. Bars will not be opening up in this month. That decision has been made, but we will be looking at the factors with regard to how stable the hospital system is and so forth, and looking at, do we think that this is something that we think we're stable enough that we can start loosening other restrictions, potentially on bars as well. So I'd say stay tuned on that one. We'll be making that decision based upon what we see this month.
That's all I got for now.
Okay? Yeah. So the question is, why are bars being treated differently from restaurants? And it really gets to that idea of social distancing. I mean, if you think about just when you've gone to a crowded restaurant, everybody, even in a crowded restaurant, people are typically sitting down at tables where there's some separation. And of course, what we've done with the DHM is we've made that mandatory. There's got to be a 6-foot distance between the table and the next table. We put in other restrictions on that as well. Now, think about the most crowded bar you've ever been to. Was there 6 feet of distance between anybody? It was all very close. And again, this is the whole thing. So taking us back over a couple of months ago, when we started getting briefed on what fighting a pandemic looks like, part of it was really the big key, limiting size of groups of people that are mixing together, because that's how the virus spreads. So this is one of the reasons why, for example, schools were one of the first things that started operating without students, because that's the most highly concentrated place in our society where people get together, is when kids are in a school building. And bars aren't that far that far behind, right? So you have a lot of people in a bar, and so because that's such a dense concentration of people, that's why bars have been treated differently from restaurants, because restaurants, even though, and again, remember, we took steps on restaurants too to not allow dine-in originally, but we've released it to 50% capacity, and again, it's a step. So we've been taking this, as we've been loosening restrictions, we've been doing it a step at a time to make sure that we're not going to let the virus get that, spike back up and overwhelm the healthcare system. So again, we're doing this a bit at a time. Bars are more concentrated groups of people, so that's why they've remained closed, whereas restaurants, we allow to go to a 50% capacity. Yeah, Lee.
You did the Kickstarter, sort of with the contact tracing, how you had the teams sent out, or at the call center rather, to do their work. Can you kind of give an update on how that progression has been and what the feedback has been from the people that have been reached out to, and like how that self-isolation has been playing out?
Yeah, so let me again take a step back here. So historically, typically, local public health departments are responsible for doing the contact tracing and asking people to quarantine and isolate. Typically, most of the public health departments will have maybe 7 to 15 people that they can devote to that. And in some cases, it's even fewer number of people. So what we did is we stood up our team at the Department of, or in a lot of DHHS, a lot of Department of Health and Human Services people were stood up to be able to help be a supplement to the local public health department. They're still directing how those resources are being used. We're just supplementing those. So we've got about 250 of our teammates that are now trained up and deployed on call center teams to assist the local public health departments to do that. And the public health departments have been very thankful for the extra help to be able to do that contact tracing and getting that person who's been tested positive to isolate, getting everybody else contacted so they can start monitoring their systems and quarantine and so forth. The feedback I got so far is that the public health departments are very pleased. Obviously, we're reaching out and getting to people. There's some other things that we think we can improve upon, with regard to how that information that we collect is getting fed back to the public health departments and so forth. So we're still kind of working out the system, but so far the reviews, I think, have been very good from the local public health departments who are responsible for doing this, and they appreciate the extra resources to be able to make sure that we're trying to get to people as quickly as possible. Still been, there's some places where we got to make sure we're continuing to have good information flow back and forth, and we got to develop some systems to be able to do that, but so far I would say the reviews have been positive.
What about the compliance from the folks that you reach out to? Because you're telling these people in theory you gotta stay home for 14 days, and the branch that may reach out for some of those folks that are positive is pretty far. What is the response been from these folks?
So the question is, what about compliance? Have people been doing it? And again, typically, I don't know that we have data on that per se, but we do follow-up. Do you have, actually, Dr. Anton, do you
I don't
have?
have any data, but yes, they do get follow-up, and they enter, whether they're asked to monitor or not, they're asked to enter into a text message or into a database on an email.
So we do follow-up phone calls with people to remind them they're supposed to be quarantining. We do text messages to them, and they text back to let us know if they're actually doing it or not. So while we don't collect any specific data on whether or not people are actually complying, we do follow-ups to ask them to continue to do it.
That would lead me to my final question of, the goal is to make sure people aren't going out. Why is it that the contact tracing is important if you can't track whether or not it's effective or not?
So the question is, why is contact tracing important if you can't actually track whether it's happening or not? I think it's, again, what we have found through this entire pandemic is when you ask Nebraskans to do the right thing, they do the right thing. So when we ask people to stay home, I'm thinking it's going to be the same deal, that when we've asked people to do the right thing, they understand that it's a public health risk to go out and potentially spread the virus. And we're calling them to remind them, but at the end of the day, we don't have enough police to be able to go out and enforce it, that we sit on everybody's doorstep. So that's why we ask people to comply. And that's really been our entire approach throughout this entire pandemic. We don't have enough police to sit on everybody's doorstep. What we need, and I'm sure Colonel Block will agree, he doesn't want to sit on anybody's doorstep. So what we need is people to comply voluntarily. We need them to do the right thing, and Nebraska's been doing the right thing. So while there probably are people who we call and ask to isolate or quarantine and they don't do it, I'm going to give you a guess that by and large, Nebraskans do the right thing, and they have been doing it.
We're going to have Felicia here in a couple days to talk about contact tracing.
And we're going to have Felicia here in a couple days to talk about contact tracing specifically, so she can probably get into more detailed questions. So Lee, hold those questions. She'll come back and get you more details. And now we know what you're going to ask, so we're going to warn her, okay? Martha.
I have a reader question, and this is someone who wondered about the baseball and softball. After June 18th, when games can be played, what about tournaments involving teams from other states and Nebraska teams going to other states to play games? What's your thought on those?
Yeah, so the question was with regard to baseball and softball tournaments after June 18th, what about teams that are maybe coming here from other states, about Nebraskans going to other states to play tournaments? And I would say that, with regard to the tournaments that are going on here, they will have to be conducted in the same way to comply with the guidelines. So so we talked about in the guidance specifically about how games are to be operated. If you're going to do tournaments, again, you're going to have to follow all those same sort of guidelines, except on a bigger scale. So you're going to have to keep all the teams separate. There's going to be separate areas for them. Spectators are only going to be allowed to stand or bring their own chairs. They're not going to be able to sit in the bleachers because the teams are going to have to be doing the bleachers. So when you're done with the field, you're going to have to sanitize everything. So before the new team comes in, so all those sorts of things. And same thing, if a team is coming in from out of state, they're going to have to comply with all those sort of standards. And if a Nebraska team is going elsewhere, I would encourage them to follow the same sort of standards that are either going to be in that state or, using those good social distancing guidelines. Again, I would ask them to use common sense and good judgment. So don't go play a tournament necessarily in places like New Jersey and New York, where we know that there's still a lot of virus floating around. But if you're going to South Dakota, I don't know that anybody's, by late June, I don't know that anybody's going to be too concerned if a baseball team is traveling to South Dakota.
You would not expect them to observe the 14-day quarantine that you talked about for travelers?
Right, so the question was, well, what about the 14-day quarantine? The quarantine that we put out there extends through the month of May. Obviously, if we re-extend that through June, we'll have to give some guidance regard to baseball teams that are coming into the state. But right now, the 14-day quarantine applies to people who are coming in, through the month of May.
Governor, we have a couple of questions that have come in. One is Mark Bomber at KSNB says he's a viewer that called to ask, she got a stimulus check for her deceased mother. What should she do to return that?
Mark Bomber, KSNB, has a listener who called in and said, I got a stimulus check for my deceased mother. What should I do to return that? That, I don't know off the top of my head, but that would be a great question for our Department of Revenue to help us out with. So maybe we get Tony Fulton to answer that, Taylor, and maybe you can just respond back to him directly.
And then Tara from Channel 6 has a follow-up question, just asking, are you open to expanding mobile testing in South Omaha beyond One World?
So the question is, are we open to expanding mobile testing in South Omaha beyond One World? And we're going to be, taking a look at a lot of different solutions. I think that in talking to the folks at One World, for example, they thought it would be better to be doing it there because it's a trusted face in the community. And I tend to agree with them on that. We will have other mobile testing sites in Omaha, and certainly those are not exclusive, so that people in South Omaha wanted to use those, they'd be able to use those as well. And we will be moving around those sites as, sites right now. CHI Health Center, for example, is where we've got people located. So we will be, adapting our testing to suit the conditions. Yeah.
How many COVID-19 patients are in the hospital right now? And do you have a percentage of how many of those patients have been hospitalized?
So the question is, how many patients are in COVID positive patients are in hospitals right now? Is it 184? What is it, Dr. Antone? 192 today. 192 patients in area hospitals out of a total of 3,800 some beds that we've got. So the percentage is relatively small. And I'm sorry, was there another percentage you were asking for? How many?
What is the percentage of COVID-19 patients in Nebraska that have needed hospitalized?
So the last number, I'm going to actually call Dr. Antone to talk about this more in detail, but the last time I checked, it was roughly about 5 or 6% was the hospitalization rate for coronavirus patients. Is that about right? So do you want to come up and say anything else? Dr. Antone, you haven't been up here in a while. You probably should come here and talk.
Yeah, besides the dashboard that we have out on our DHH website, we have our own little dashboard that we keep track of on a daily basis. And at this time, we're watching it very closely because of the elective surgeries starting back up a couple weeks ago, and then again this Monday, and then again probably next week. So I've seen the data change maybe 1 or 2% both ways. So we are seeing a little bit more of an increase in the COVID positive patients in the Douglas County area, the Douglas County Health Department, but really not a major change as far as percentage goes. As the governor mentioned, we have 192 COVID positive patients throughout the state of Nebraska in the hospitals right now. Of that, Douglas County has 89 of those patients. And I do keep track of call the CMOs and talk to the CMOs of the major hospitals throughout the state. If anything, the rural part of the state or the non-eastern part of the state is very, very stable at this time. We used to mention about Lexington, Grand Island, Kearney, Norfolk, very, very stable at this time. So right now, we're sort of concentrating on the Douglas County area and the Lincoln-Lancaster area, but our capacity is great. We still have, as the governor mentioned, 75% ventilator capacity, even in those areas. So,
You want to mention about Sioux City as well?
yes, Sioux City, I was in contact with my counterpart from Iowa, the state health official from Iowa yesterday. And obviously, we've offered our help right up front for Sioux City, Iowa, because the patients that were on Sioux City, Nebraska side of the river use the Sioux City, Iowa hospitals. And they have transferred down some of the patients to the Omaha area, but they've also transferred some patients within their own system in Iowa. And right now, the state health official I talked to yesterday from Iowa said that area is starting to stabilize out now, too. Yes?
Do you think we've seen our peak and it's past now, then?
So the question is, have we seen our peak and it's past now? I don't want to say that because I see all the models say that we keep pushing our peak back. But as Governor keeps mentioning, we have definitely flattened that peak. No doubt about it, and especially as far as healthcare resources go. We have maintained our healthcare resources throughout all this, and I can only thank all the hospital CEOs, CMOs, public health directors. They're the ones that really did it. I mean, when the situation happened in Grand Island, when the situation happened in Lexington, even when the situation happened in Sioux City, they did an excellent job of keeping things under control. And everybody collaborated as far as putting a hand in to help. There was nobody that didn't want to help out, let me put it that way. So I don't know about our peak. I'm an optimist. I want to say we've handled it great up until this time, so I'm looking forward to the same thing going forward.
And also add all the nurses and doctors who worked very hard to be able to manage all that too. So, Fred.
Question for Colonel Bolton.
Colonel.
Sir.
You mentioned the statistics on speeding over 100 miles an hour. How does that compare to pre-pandemic period, and what do you think's going on?
Great, thank you. So the question was, how does the increase in speeders over 100 miles an hour compare to what would be normal, say several months ago? I don't have a percentage increase, but I can tell you that it's a substantial increase. If we look at the data from the Department of Transportation, we're seeing that traffic counts are very low. And we all can see that. If we drive from here to Omaha, we see the interstate has very little traffic other than commercial motor vehicles. So it is an assumption that in part because of the lower traffic volumes, the opportunity exists for people to speed. Now, what possesses someone to go greater than 100 miles per hour? It would be only a guess on my part, and it probably would be wrong. But we just need to stress that it's not safe to travel at those speeds on our interstates, and we would just ask folks to be mindful of the other motorists that are out there.
I just wonder if the troopers are reporting that people are feeling cooped up, so they're getting out.
You know, that would be a fair assumption, I think, under the current circumstances. But the feedback that we're getting from those folks who are deserving of our intervention just really don't seem to have any rhyme or reason to it. I think the opportunity is there, and some folks are taking advantage of it. But we are out there. We're still enforcing, the guidance we gave to our folks was, let's make sure that we enforce the obvious, egregious violations, and certainly we've asked our law enforcement officers to use great discretion to make fewer contacts. That's not a secret. The less contact we have with the public, the safer the public is, and the safer our officers are. But still, we have to do our job, and we have to make sure the motoring public is safe, and really go after those obvious safety violations that tend to be out there.
Colonel, I think Lee wanted to do something.
Yeah, similar
Sir.
question along that line. What has it been like for your team to kind of, through the evolution of all of this, right, to kind of take on the realization that this is happening and then change your guys' practices, and what has that challenge been, and how has that development happened for your team?
Thank you. So the question is, what has it been like for our troopers, our staff, to go through this unprecedented experience? It's definitely different. I can say that the morale of the troopers is high, but they're also anxious, like everybody else, to have this thing get over with, whenever that might be. You have to remember, that our troopers, our dispatchers, our civilian staff that are supporting this team, we are all community members like you all, and we have families, and we have kids that are not in school, and we have spouses that may or may not be working or working from home. So all the common experiences that everybody else is experiencing right now, our troopers are experiencing that as well. And then you add the stress of being a law enforcement officer, which, don't get me wrong, this is a profession we've all chosen, and we're proud to do it. But those cumulative stresses, just add an extra measure of challenge. But I can tell you that our team is up for the challenge, and they're still proud to serve Nebraska. And frankly, if I can brag on them, I think they're doing a fabulous job. And we're like you, anxious for this thing to be over. Ma'am?
Can you talk a little bit about how your role has shifted? The traditional role of public safety doesn't look like what it normally does. Kind of how did you end up expanding into those different roles, and why?
So the question is, how did we end up, changing some of the roles that we're doing, and how have we adapted to that? Really, you heard the governor talk about the team that we have here in Nebraska, all of the employees at the state of Nebraska. We look at it as one big team, and how they've really stepped up and I think have innovated and have worked together. Our troopers and staff are no different. We need security at these mobile testing sites around the state. Okay, let's figure it out in a hurry. Now, fortunately, our troopers are well-trained and they're used to solving problems. In fact, they do a great job of it, and they take a lot of pride in that. So here's a challenge that we have. How do we keep our National Guard partners and the healthcare providers safe and helping moving them efficiently around the state? It's a problem to be solved, and they just have jumped right in. With the escorting the test samples from Grand Island and Omaha and other places, call from NEMA, Nebraska Emergency Management. Hey, can you guys help with this? Absolutely. We're there, we're mobile, we're not working from home, we're working from our squad cars. It's a mission that's important. We've got to get those samples to the lab. Let's make it happen. Other challenges, but it's not unlike what we faced last year. We had floods, we had rescues that had to be effected. We normally drive a car. Now we have troopers driving boats, right? And you just adapt, and you solve the problems as they come at you, and then you take a look at it afterwards and learn what you can for the next problem that comes up that perhaps you hadn't had a chance to practice. And so that's really the case here. Let's take the challenges as they come, and let's work together as a team, not just law enforcement, healthcare, National Guard, our other state teammates, whoever is needed to get the job done.
Have you had any of your officers or members of your team fall ill to COVID from line of duty interactions?
Thank you for the question. The question is, has any of our teammates fallen ill as a result of COVID? The answer is no, thankfully. We've had several that needed to isolate because of customers they were dealing with who didn't necessarily want to go to jail, said, hey, I have COVID, thinking that's a free pass. It's not, by the way. So we promptly tested those folks who said that they were ill, and then tested our folks who interacted with them, and fortunately found that none have tested positive. So we're very thankful for that, but we're also of the mindset that we have to be aware that it is here, it's in our community, somebody may unknowingly be affected and be carrying it, so we have to use all proper precaution when we're dealing with members of the public.
So did any of the people who claimed they were sick and therefore?
Yes, did any of the folks who claimed they were ill were they ill? And the answer is no. They're thankfully very healthy too. Ma'am?
I have one more data question. That's not.
Oh,
Yes, thank you.
thank you, Colonel.
How many COVID-19 patients are on ventilators or in the ICU?
All right, so Dr. Anton, I'm going to call you back up again. The question was, how many COVID-positive patients are on ventilators or in the ICU?
And updated nursing home data, if you
I do have the question is about updated nursing home data. Can I get the hospital data first, and then I have the nursing home data on my piece of paper down at I don't have the memory of the governor, so I have to have it written down. But we have a total now of 56 COVID-positive patients on a ventilator in the state of Nebraska. As you remember, I mentioned we have 192 total patients, so it's about 1/4 of patients that are actually hospitalized need to have an ICU and a ventilator, and then an additional about 25 patients in the ICUs that are not on a ventilator.
You want to talk about how many total ventilators you had?
Yeah, we have a total of 784 ventilators in the state of Nebraska, and right now 599 of those ventilators are available for use. Only 7% of ventilators in the state of Nebraska are used for COVID-positive patients today. And let me get the data for long-term care.
I can read it to you.
Okay.
292 residents,
292 residents,
218 staff,
218 staff,
yes, and 62 deaths, which is no change from yesterday.
and 62 deaths for long-term care residents. Yes, Lee?
That 7% that you talked about, do you have an idea how this compares to surrounding states that maybe have similar bed capacity, so to speak, that we do, and how their ventilators compare to ours, just so people kind of have an idea of what 7% really is, so to speak?
So Lee asked a question of that 7% of people that are COVID positive that are using ventilators, how does that compare to other states? I don't know that answer, but I'd like to know it myself, so I'll find out for you. Yes, Martha?
Well, I have a question that I don't know whether you or the governor would prefer to handle it, but
I prefer the governor, if possible.
Try it on him first.
okay. When you're looking at the data and trying to decide how are things going with the opening up, what measure are you going to look at? I mean, when you look at, you're looking at the hospital capacity, but do you say, oh, when we get to 75% capacity, or when we get to 95% capacity, that's when we better start doing something different? I mean, is there...
So Martha asked, what capacity number are we going to start saying, yes, we're getting overloaded again and maybe not having the capacity? And the numbers we usually quote are our statewide numbers, but we're really keeping track on a hospital basis now. And I will be doing that personally, be keeping track of the percent of beds available, percent of ICU beds available, and percent of ventilators available in each specific hospital throughout the state. And that's what we did for the sort of the non-eastern part of the state. Now we'll be concentrating on Douglas County and Lincoln. And it's 30%. We set the guidelines for 30% bed capacity, 30% ICU bed capacity, and 30% ventilator capacity in each hospital. So those are the numbers we'll use.
So once you're down to 30%, then you say we better start shutting that down again?
I presume that's what we'll do. We'll say maybe stop doing some elective surgeries. But again, all the hospitals, CEOs, CMOs, they've been great about this. They did not ramp up right away. They ramped up very slowly. And like I said, watching it over this last 2 weeks, I've noticed only a 1 or 2% change in all those numbers that we've had. So, you know, obviously it's going to get a little bit higher as things go on, but we haven't seen a big surge or anything like that as we've relaxed those directive health measures to allow elective surgeries. Yes?
62 out of the 100 deaths in Nebraska have been at nursing homes. Why are they seeing such a high rate of deaths? Can anything more be done there?
So the question is why are 2/3 of the deaths basically that we've had 100 deaths now from nursing facilities, skilled nursing facilities. It's all about it's all about lung capacity. Even not only in elderly patients, but even in patients that are obese or have pulmonary issues, it's all about lung capacity. Your lungs can only oxygenate and ventilate or get rid of carbon dioxide to a certain extent. The older you get, the harder that is to do. And the more comorbidities you have that affect your lungs, the harder that is to do. So if a patient were to need a ventilator, the issue is getting off that ventilator. And if you don't have that lung capacity to get off the ventilator, that's why you don't live.
So to make sure I understood this 30%. So if we're at 48% of hospital capacity now, it would have to go up by another 22 before you hit the park.
And again, the word,
Statewide.
yeah, the question is we're at 48% now of bed capacity. That's statewide. We're going to be watching it on a hospital-by-hospital basis.
But if there were a hospital that was 48% full, it would have to go up another 22% to hit. I just want to make sure I understand.
That's correct.
Okay.
It would have to go up to at 30% or not have 30% capacity.
So 70% full, 30%.
Exactly, yeah.
Would it be fair to say that unless we reach that measure of that 30%, you can expect to see consistent changes with restrictions being lifted and, so to speak, if we don't get to those numbers?
So the question is as we get close to that 30% rule and we think things are getting better, is that what you're asking, Lee? Are we going to extend that to 20% rather than 30%? I'm going to leave that one for the governor, but I don't know.
Yeah, so again, we're going to watch what's happening with regard to the hospital system. And so we're, again, I think as Dr. Antone says, it's going to be on a hospital-by-hospital basis. So we've asked hospitals, for example, to maintain 30% of their capacity right now. And as we get more experience in this, yeah, we might drop that down to 20% or 10%. But we're going to, again, look and see what happens with the data over time to get kind of a feel for how we're being able to manage the healthcare system and do it on a hospital-by-hospital basis. Yeah, Brandon.
I know the Secretary of State will provide an update tomorrow, but have you had any sort of feedback or contact with him about the election and how things have been going, and if there's been any issues?
So the question was, have I had any contact with the Secretary of State about the election today and any feedback on how things are going? I have not talked to the Secretary, so I do not know how things are going. I can tell you, based on my small experience, I went to vote today, and I showed up right at 8 o'clock. I was the only person there to vote. When I turned around to the left, there was one other person walking in. Usually there's a line at my polling place. So I am guessing that many people took advantage of the opportunity to be able to send in an early ballot and dropped it off at their county box or drop box or whatever. So I'm not anticipating that there are going to be any issues. As you know, we did make the National Guard ready to be able to step in case there was a shortage of poll workers any place. But I got to tell you, I probably would have heard something if something was going on.
Time for a couple last questions.
Couple more questions. Okay, well, I'm not going to make everybody sit here in silence. Thank you very much again, everybody, for coming here to be able to talk about what the state is doing to slow the spread of coronavirus here in Nebraska. I want to thank again all the Nebraskans who are working so hard to be able to make those sacrifices to slow down the spread of the virus here in Nebraska. It is absolutely working. We've got to continue to do this. Again, this is something we're going to be doing for a while, but I appreciate everybody's participation, and we will continue to have these press briefings the rest of the week. Weekdays, 2 p.m. Central Time right here. We'll be doing our Spanish language briefings at 5 p.m. Central Time, Tuesday and Thursday. I'll be on NET, Speaking of Nebraska, with Dennis Kellogg, 8:30 Thursday night. And I believe we got Dr. Ashraf is going to be there. He's going to be there talking about what we're long-term care facilities, and I think there'll be another guest who's not been determined yet. So, but please tune in for that. Thank you all again, and we'll see you back here tomorrow.